Let's start our coverage in Los Angeles. That city is under new stay-at-home orders as coronavirus cases, deaths, and hospitalizations have reached record levels. CNN's Paul Vercammen is standing by with two leaders of LA's massive free testing campaign. Paul?
Yes, and as that free testing goes on behind me, Boris, almost 3 million by CORE. I'm going to bring in Sean Penn and Ann Young, the co-founders of CORE. And right off, as we look at all of this undertaking going on, we know that there's tremendous anxiety as the hospitalizations are surging here in Los Angeles. If you could say or do one thing right now to head this off, what do we need to do?
Well, I think now is the time to really quadruple down on all of the common sense efforts of masking, social distancing. We know that there is this finally this light at the end of the tunnel with these vaccines starting to come online. But what people need to know, for example, with the Moderna vaccine, Moderna itself doesn't know yet if that is going to impose a low-level asymptomatic COVID that is therefore transmittable, and that many people after having the vaccine may have to isolate for a period of time. There's a lot of unknowns this way, but we know we're getting close. And And so now's the time really that we have to recognize just how vulnerable we are and be humble to it.
And your relief experience includes Kosovo, the Congo, Haiti. When you see this undertaking going on in Los Angeles, what runs through your mind?
What's scary is that it's not all that different. There's a lack of coordination, there's a lack of leadership, and what's scary is that, the private sector and the NGO sector has stepped up in such a major way in this failing.
So CORE has spread this free testing throughout the nation, but it's not everywhere. And what's the next step for you? Where do you get it to cities that desperately need this free testing but don't have it?
Well, we're very ready in terms of our model to spread throughout the country beyond those areas that we're already serving. We're very hopeful that the next administration is going to move that forward, but we're really dependent right now, not just on the states and, where we've had leaders like Governor Newsom and Mayor Garcetti or Governor Cuomo in New York, where they have been very diligent on these things, but those hundreds of millions of dollars that are coming down from the states are just not going to do enough. They've been putting it all out front. We need federal funds, and can speak to the CARES Act issues on this.
We need CARES Act to be extended. Right now, all funding stops December 31st. That means there's no more funding for this testing site or the testing sites that we have across the country, and that's problematic. Without that being extended, as of December 31st, testing goes away, contact tracing goes away, supported quarantine goes away. We need Congress to act fast.
And Sean, while we have you here, I want to ask you why you do this. As some people may or may not know, your father, a bombardier, a tail gunner, fighting World War II, laid to rest not far from here. In a way, he was at war, and you're at your own war. Why did you get into this to the degree that you did?
Well, I have to say that my father represents most of my aspirations, yet still most unfulfilled. But in our family, there I think was a real emphasis on the value of service, and we know now that one of the silver linings in this COVID experience is the nature of public-private partnerships and the exposure really of the need for that, so that we can come as citizens and work with governance to be able to do the kind of expanded care that's going to be needed, not only through the end of COVID but through the entire vaccination process. One of the things that we've been working on, we have a pilot program on this in Washington, D.C. now, because we all recognize the importance on so many levels of getting kids back to school. So we want to make sure that we find ways to create bubbles the same way the NBA has it for the teachers, and the testing to be pervasive throughout.
Can you talk a little bit more about that, Ann? You wanted to model the NBA for this program that you envisioned for children getting back to school safely and, of course, protecting the health of their older teachers.
That's right. We need to treat our teachers like NBA players. We need to take care of them as much as we have with the NBA groups. And I think that it's so important right now, especially to do screenings, rapid testing screenings, and that's what we're focusing on in these schools in Washington, D.C.
Okay, both of you get to sit down, let's say, with President Biden. And what do you say to him? What is the one thing that you think that he should do first?
Well, I would go straight to, because our lane on this, and it's only one component of it, is the testing and the contact tracing. It is a misnomer that contact tracing isn't working, because where it is working, for example, on the Navajo Nation or in Fulton County in Georgia, where we have a direct hands-on door knock team doing it. It is, President-elect Biden knows what to do. I've heard him speak to it. What I would say to President Biden is that CORE stands by at the ready to do all we can to help them do it.
Great. I thank both of you so much for taking time out in front of your test site here, and congratulations on all the testing that you have achieved and got done here. Sean Penn, Ann Young, you heard it right there, Boris. They're on the ground with this every day with LA's free testing program just absolutely swelling, and many people ramping up ahead of what they expect to be just another dramatic rise in hospitalizations.
Yeah, the pandemic certainly revealing a lot of the iniquities and injustices in our society in a very prominent way, but it also highlights those who go out of their way to be heroes and to help others, and we thank them for their work. Paul Vercammen from Los Angeles, thanks so much.